Good evening. Welcome to the Ask Me Anything. Tonight we have some questions that are going to help you become heart attack proof if you're not already. I'm Dr. Michael Twyman, a board certified cardiologist, and my practice is Apollo Cardiology in St. Louis, Missouri. If you're interested in working with us and you don't already, if you go to my website, drtwyman.com, there's an application. One of my team members will set up a meeting with you, make sure that we can help you with your vascular concerns. And if so, we'll set up a time. I'm currently booking out about 3 months into the future. So tonight we answer your questions. Usually they're going to be related to vascular disease. Sometimes they're biohacking topics or mitochondria topics. So happy to answer those as well. So we answer them in the order received. And if there's extra time, which there usually is, we'll answer any questions that you drop in the comments. So with the housekeeping out of the way, we'll jump into the questions. So first question tonight, how to make sick mitochondria healthy again and effectively oxygenate it. So your mitochondria do use oxygen to make ATP, water, carbon dioxide, and water, the structured water that your body needs to make a water battery out of. You inherit your mitochondria from your mother, and then think of them as engines. You need to do some things that repair the engines, so that is sleeping well, and that is doing things that prevent the mitochondria from breaking. So we just jumped through some circadian rhythm disruption with the spring forward. So optimizing your Zeitgebers, the light in your eyes, the time the nutrients come into your gut, is useful to help the mitochondria know is it daytime or nighttime. So want to optimize sleep, that's when autophagy, and apoptosis happens. Exercise, extremely useful to stimulating the mitochondria. Fasting, because then you're not putting food through the mitochondria and you're not having oxidative damage. And you can consider things like grounding, photobiomodulation to help stimulate them as well. Have to be careful using things like HBOT, because if you have unhealthy mitochondria, the extra oxygen from HBOT will make more reactive oxygen species and worsen inflammation, may make the person feel worse initially. So you're thinking along the right lines. Mitochondria are the key to longevity often, and many chronic diseases are related to sick mitochondria, either in the heart or the brain. Question tonight, what is the best way to lower TMAO if you have an MTHFR SNP and need the choline? So TMAO lab, that can be checked with Cleveland HeartLab or Boston HeartLab. It is a lab that I don't want to say fell out of favor, but I don't think it is as clinically useful as once thought. High levels, were considered to be a concern for vascular disease risk factors. It may be that it's due to it affects HDL function. TMAO is made in the liver. It's made in response to how well the gut microbiome breaks down choline and carnitine, so mainly things in red meat, eggs, and fish. Those things are very healthy for other reasons, so I don't recommend patients avoiding those things. Your gut microbiome may have some dysbiosis, so you may want to consider working there. Your light entering your eyes informs your gut what's going on. So if your gut microbiome is not optimal, you want proper light signals in your eyes from sunlight. You want sun on your abdomen to inform the gut microbiome what time of day it is, what season it is. And you may consider taking things like probiotics, at least short term. But I don't currently check TMAO in every patient. I will on occasion, but the MTHFR, that is extremely common. That is also not necessarily a big concern for most people. Look at your homocysteine levels, look at ADMA, look at B12, look at folate, and supplement with a methyl B complex if needed. Next question, which is the most beneficial to the cardiovascular system, coffee or tea? I don't think it's an either or, it depends. It's the polyphenols and the antioxidants you get from those that are probably the benefits. Caffeine, some people don't tolerate very well, and it actually increases the risk of cardiovascular events. It may increase blood pressure in some, may worsen palpitations, can affect sleep if people are slow metabolizers and drinking caffeine too late in the day. So not saying that one's necessarily better than the other. It's what do you tolerate and what do you enjoy. Does isometric exercise offer unique benefits to the cardiovascular system? It can help lower blood pressure for one. And do grounding mats or sheets work? So all animals are grounded. Humans are the only ones that electively decide to sleep off of the ground. Grounding mats, ideally, would have a wire that goes outside and goes into a grounding plug in the ground. Would not recommend plugging them into the outlets, even if you've used the little tester that comes with those. That just tells you you're not having, a serious electrical wiring issue if the thing looks normal, but that doesn't tell you that, what is in your environment. When you lay on these grounding mats, you're basically an antenna for all the non-native EMF that's in your environment. So if you have a smart meter nearby or a cell phone tower or Wi-Fi routers, you may be attracting those EMFs to you while you're laying on those mats. So don't usually recommend grounding mats unless you're using a wire that goes outside into the actual ground. All right, those are the pre-submitted questions tonight, guys. Look for any questions, comments in the feed here. I don't see anything just yet. So we're waiting for any comments that may come through. So I do have the school community. It's drtwyman.com/school. That's my private community where I do more teaching. I have long form content. I just did an hour and 20-minute AMA last Friday. I use AI tools to transcribe the entire AMA, and there's recordings available for people who want to do, things to make notebook LM flashcards with it if they're interested. Using a lot of AI tools in there to, better educate myself as well as the people who have joined. There's courses in there on how to read your own labs. There's courses in there how to become heart attack proof. There's a free 7-day trial if people are interested. So no obligation. Check it out. And if you want to stay with us, happy to have you. And this is where I'm going to be, continually, learning along with you guys. So when I hear interesting podcast, when I learn things on the road, I'm going to be going to the American College of Cardiology conference in a couple of weeks. That's where I'm going to be dropping that information. There was a very good podcast recently with Dr. Doug Wallace. If you search for Doug Wallace, he's one of the world's experts on mitochondria. He's the one that actually discovered that mitochondria are inherited from the mother. He's 79 years old. He's extremely sharp. The podcast that he had recently was outstanding. It's very technical in parts, but if you sit down, take some notes, you'll really understand why you got to really focus on optimizing your mitochondrial function. All right, and then we got a cardiac question coming in. What are my thoughts on EECP? It is useful for some individuals who have severe coronary disease and aren't necessarily candidates for revascularization with either stents or surgeries. EECP is external extracorporeal counterpulsation. Essentially, it's blood pressure cuffs that are on the extremities, and they squeeze in a kind of wave-like form from like the feet and move upwards to your arms. That squeezing of the blood vessels stimulates nitric oxide production, and it's similar to the exercising without exercising. So in further comments, the person says they have all three. I assume means coronary disease, 80% blocked, and have declined surgery. They want to buy time with the EECP. It's possible. It can help with the microcirculation as well. 99% of the blood vessels are smaller than human hair. So you may have blockages in the main coronary arteries, but you still want to have optimal flow down the microcirculation. And that might buy some time. But questions you need to look into is, what is your ejection fraction? If your ejection fraction is low, you want to get revascularized sooner than later. The risk of sudden cardiac death increases if the myocardium is already weakened. All right. See, I don't see any other questions coming in at the moment. So short and sweet as usual. So my school community is where if you want to learn more about how to become heart attack proof, check it out there. I still have a YouTube channel. It's drtwyman.tv, but there's not a lot of new content there other than some archives of these kind of long form talks I've done in the past, plus the Ask Me Anythings I'm doing on Instagram. So if you miss it on Instagram and need a place where there's actually a description of the questions, check out the YouTube channel, which is just drtwyman.tv. So appreciate your guys' time and attention as always, and I'll see you next Monday, 6 p.m. Central Time.